When everyone think of healthcare, they think of maintaining or preserving health, from their families to friends to loved ones to even strangers. So we want a healthy community, we want a healthy household. The British Virgin Islands Health Services Authority for many years now have embarked on everything possible to make quality health care available right here in the Virgin Islands. I am Franka Potter and I want to welcome you to Health Watch. Health Watch is a program brought to you by the British Virgin Islands Health Services Authority, where we will bring you everything happening from inside the authority. We will update you on initiatives, new programs, activities, and we will even address many of the concerns by the public, because being the preferred provider of healthcare in the Virgin Islands is our #1 priority. We have a lot of guests lined up for you today, and I want to thank you. We have from the chairman of the board, Bishop Klein. We have our CEO, Mrs. Darlene Carty-Baptiste. We have June Samuel, our chief of medical staff, and we have a visiting physician who's doing a groundbreaking procedure right here in the New People's Hospital. Again, I am your host, Franka Potter. Thank you for joining, and we'll be right back. The British Virgin Islands Health Services Authority is delighted to present the New People's Hospital to the residents and visitors of the Virgin Islands and beyond. The government of the Virgin Islands dedicated this new state-of-the-art facility in December of 2014, and a full transition of patients and services were completed to usher the Virgin Islands and the region into improved health care for 2015.
We are the BVI-HSA.
We are the BVI-HSA.
We are the Human Resources Department.
We are the BVI-HSA.
The New People's Hospital is one of national pride and hard work, but above all, it represents a commitment for optimum health care and well-being. We are staffed with certified doctors, nurses, pharmacists, lab technicians, and other employees working together to ensure that our patients' experience is one of excellence. We are one BVI-HSA, and People's Hospital is for you, for me, for our families, for our friends and neighbors in and around the Virgin Islands. At the British Virgin Islands Health Services Authority, only excellence counts. Welcome back to Health Watch. Again, I am your host for this program, Franka Potter, and joining me is the beautiful Ms. Darlene Carty-Baptiste, and she's our Chief Executive Officer, our Commander-in-Chief.
Oh, wow.
Mrs. Baptiste, welcome.
Thank you so much. I'm speechless. Thank you for that lovely introduction.
You know, everyone gives you that. How are you?
I am doing fabulous today.
Yeah, it's been a while since the authority had a Health Watch program, and we're happy to have it back. I'm honored to host it, and I'm honored to have you as my first guest.
Oh, thank you so much. It's just a long-awaited anticipation for this moment, and I'm glad that you're here.
Thank you, thank you. So tell us, and our viewing audience, and you know we have our audience on YouTube,
yes.
So we international, and we have everyone out there, everything that's been going on in the authority. You've been very busy for the last 4 years.
Yes,
yeah?
Most definitely. We've gone through some serious growth, not only the business lines of the services, but in the number of persons that are introduced into the BVI-HSA. And of course, we are looking and focusing on quality.
Yep.
We have been really concerned about the quality of services that we provided over the last couple of years, and we have also introduced some services specifically on patient relations. And of course, with you coming on board, we're looking at the branding and marketing and how do we fit into the global healthcare industry, not just within the BVI or the region, but again in the world. The dynamics are changing, and as it changes, we have to be prepared for that change also.
One of the major things is the client service care push. Tell us about that.
Well, we noticed that we haven't been consistent, and we've been using that word a lot with the provision of care. One person may have an excellent experience, but when we have that one little hiccup, how do we address it in real time for the patient recovery, and also looking at meeting or exceeding the patient expectation? So the introduction of the client services as we work towards accreditation. We look at meeting the patient not only in the point of care, but at the continuum of their health care, and also their family members, getting them to understand what are the true emergency, the non-emergency to the emergencies in the emergency room. A point of discharge for them being educated with the new forms that we're introducing as they leave the service. So it's just a wraparound of being more responsive as we receive complaints. We have a complaints officer, so those are addressed within 7 to 10 working days. We have our case reviews for those adverse outcomes, because again, it's not a perfect system, but at least if we communicate to the patient what's going on, again, their families, we have the ability to have a better rapport with the patient and let them know that we really take to heart the provision of the care that they've entrusted to us.
We've been in the new facility now for over a year and a half. On our radio program, one of the hosts on Z-Rod, one of our sponsors, he liked to say that the baby is now walking. That's what he calls the institution.
Okay, nice.
The baby is now walking. What does that mean exactly as to where we transitioned from the old people's hospital into the new people's hospital? And in a year and a half, a significant amount of development initiatives and changes have taken place. So let's chat a little bit about that.
Well, I mean, we talked about some of the services. We've seen a lot of new faces, and we're having partners coming in from outside the BVI, coming and partnering and coming online to give us those specialty, subspecialty services. And so it's really important for folks to understand that, yes, we may be toddlers, but you still allow the toddlers to have those little baby moments once in a while. So you will have those little stumbles and falls, but again, give us the opportunity to address them. And I think a lot of it comes from shows like this. We have the website so folks to go on to. We have the Pulse magazine that has been reconstituted. And of course, this show gives folks the opportunity to hear everything that we have going on, from the introduction of a full-fledged internal medicine team and what does that really mean for the country. The disease burden, we look at nutrition and dietary services and how we expand those in our outpatient services. And the fact of, on the other side, we look at risk and quality and the accreditation. What does that mean for the health institution, and what does it mean for the country at large? And of course, we've been throwing around the word medical tourism and what does that mean for the country as an economic pillar? Because we have the wellness tourism, the medical tourism, the dental tourism, the wellness tourism, and the rehabilitative tourism. So, but again, we have to have the core strengthened. Infant, toddlers.
Of course.
You build the core. The maturity levels come by knowledge. So we look at what's going on across the country, because what's going on in the U.S. is eventually going to trickle down to what's going to happen.
Of course.
And we have to be prepared. And while in our infancy, toddler stage, we had the introduction of the national health insurance. So it's a large learning curve for us all. So again, we ask for folks to be patient. As we grow and communicate with you, communicate back to us.
Oh, I don't think they have any problem communicating back to us.
No.
The Community Bulletin Board, and we want to encourage everyone to visit our Facebook page and like us on Facebook, so that will allow us to have a better rapport with the audience and a back and forth. And the new client services complaints, compliments, and concerns hotline, phone line is activated, is 7777. Maureen Smith, she's the client services manager, and we'll speak to her later on. But just to go back a little bit, because you stated about the medical tourism, and this week we are having a groundbreaking procedure, right, by T.A.C, the Atlantic Clinic. Tell us a little bit about the Atlantic Clinic.
Well, they're a group of physicians. They're a large network up and down the east coast of the U.S. And what they're doing is they're actually taking a cadre of, we're doing principal cases first, bringing their patients to have services here in the BVI. So while they're here vacationing with their families, they have the ability to have minor procedures done. And over the lifespan of the agreement, we're going to actually start introducing some of those services to residents of the BVI. So likewise, instead of going off island for such care, you can have the care here by U.S. trained physicians. But again, it behooves us to come back to that place of being accredited, having that gold seal that we do meet the minimum qualifications for quality standards for healthcare, the provision of healthcare.
Okay, that's excellent. I'll get to speak with some of the physicians later.
Nice.
We are hoping to speak with the patient as well.
Good.
Let's talk a little bit about confidentiality. That was one of the major concerns that the community had for the Old People's Hospital as well as for the British Virgin Islands Health Services Authority across the board. What has changed?
Well, I think we've made a great effort, because when the things are brought to our attention, we've done the due diligence and have the investigation of the cases, and those employees, or should I say former employees, who have been found, it's been found that they were contributory to information being disclosed, those persons have been released from the service. And it's just really, it's hard for us to do it for every single case, because a lot of folks really don't feel comfortable coming forward, because again, we're a very small community.
Yep.
Folks know each other, and just some innocent bystanders having a basic conversation, overhearing that an individual was sick, or another family member telling someone else. So again, we have a small community that's advantageous to us in certain instances, and this is another instance where it may not be as advantageous to us, because everybody knows everyone. But again, internally to us,
It's zero tolerance.
it's zero tolerance. Once we have the evidence, due diligence, go through the reviews, those persons are excused from service.
Oh, that's a good way of putting it. Well, we're going to take a quick break. And when we come back, we are going to share about what's happening inside the British Virgin Islands Health Services Authority. We'll be right back.
Hi, I am Marina Bidu, the Expanded Program on Immunizations Manager, and I'm coming to you today from the Toy Box. The Expanded Program on Immunization, Ministry of Health and the British Virgin Islands Health Services Authority reminds parents and guardians to ensure that your child or children's immunization status is updated. You can visit any of the public health centers for more information. Remember, immunizations are important, and they can save lives.
Welcome back to Health Watch. Again, I am your host, Franka Potter, and again, joining me for our second segment is Mrs. Darlene Carty-Baptiste, the Chief Executive Officer here at the British Virgin Islands Health Services Authority. Ms. Baptiste, we have a new strategic plan on the table, a 2016 to 2020. Tell us a little bit about that.
Well, I mean, it speaks for itself. 2020 vision is going to give a new direction and some clarity to what we do here at the BVI-HSA. We're really looking at some of the cultural pieces. We're looking at performance, the growth for the authority, because we need to be to the position where we become self-sustainable, and what elements will have us do the growth plus do the operational pieces in a more financially viable environment.
Don't mean to cut you off, but persons may think that the institution, again, it's a public institution, somewhat funded by government, and now we have NHI. How can we educate the public to a place where they have an understanding that the authority have to function in terms of paying bills, paying salary, getting supplies in and things like that? Because I think the transition from the old building again into this new facility, it wasn't well received, and I think it was just a lack of understanding as to how the operation of the authority works.
Well, to me, I found it a little disheartening when I came almost 4 years ago, that folks really took offense when I said, operating within a business model. Healthcare has a cost, and it's a very high cost. While we address the social and the healthcare needs of the community, the fact that regardless of anybody's ability to pay, which is now kind of subside because of the national health insurance and those persons who are now registered for it. Just like any other business, we have employee salaries, benefits to pay, we have vendors and suppliers, the utilities, which is a big piece. But in the confines of your business model, it's really important for us to have due diligence, and I understand the fact that we need to look at, we have value for money. Are we partnering with the right buyers and suppliers? Are we looking at cost-saving measures specifically to our utilities, of which we have done?
Yeah.
We've gone through a really strong lighting exercise, and we're changing out the lights in the entire way. And we're doing it floor by floor in the new hospital, and we already completed the annex and the and parts of the old hospital. And some of the thing is, are we looking at some of our low-hanging fruit, those services that we can automate? Again, for greater efficiency. So it may not come across as a hard line that we're looking at business model, but again, the industry itself states that we have to have value for money, and that's business.
That is business. And let's go back to the strategic plan. We know the 5 pillars, the 5 foundation pillars. Tell us a little bit about that.
So I talked a little bit about the culture, the performance. We're looking at care. How do we provide care, not only in the confines of needles and shots and bandages, but again, meeting the person's need for the total man. And the introduction of our chaplaincy program.
Yes.
So which is really good for the social well-being and spiritual mindset, because again, studies have shown that persons do have a better outcome when they are spiritually sound out. And it doesn't have to be, what we think spirituality is going to be, but what they mean spiritually means to them.
Wow.
So we're introducing that, and of course the patient care experience, not only for those persons who are coming in from or our residents, but our residents, non-residents, but also for our residents. I love our ladies at the client services. They have added such a breath of warmth to
and security.
Yes, and our security. I want to say guys, because we do have some ladies. I think we have
Our
3 ladies.
security officers.
Yes, so how they're dressed and clad. They give give you that assurance that they are looking out for the well-being of the staff, but they also look out for the well-being of the patients and making sure that our surroundings are protected.
Yeah.
And of course, they're the pieces of the growth. It comes down to dollars and cents. For us to be paid, and for the suppliers to be paid, and for us to continue growth within the organization, it takes partnerships.
Yeah.
We can't do it by ourselves.
Also, what about the pledge program? We all have heard by now of the pledge program. We're still accepting donations, so please write us those checks. Every dollar counts. But we're going into the foundation, and that would allow persons internationally to be given the opportunity to donate and possibly have tax write-offs in the States. Tell us about that.
So we have our legal counsel, Ms. Moselle Paul, counsel for the authority. She's working with the board and helping to craft what it should look like. We were looking at some of the models from other Caribbean islands and developing trust. So with her and Ms. Patricia Malone-Smith from our Director for Hospital Services and Operations, kind of helping us to craft how best we should establish the trust. And again, we have persons who are literally just waiting for the establishment of 501c3 status for those tax exemptions or tax write-offs, so you could actually contribute. So they're working aggressively on that. I know the chairman is really keeping them on the count to make sure that is done in short order.
Yeah, and with this being our very first program, I really have to give you the opportunity to thank all of our donors so far. So many people have given, from $1 to 1.5 million and everything in between, from family members raising money to companies fundraising or just pledging that they would give. If you want to just let the community know.
I'm always grateful for those who come alongside us in reference to providing the financial support, and even so, those persons who volunteer to do the reading for the patients, walk and talk with the patients through the hallways. Any little bit counts, but those persons who have actually put cash and checks towards the provision of care, from a grateful heart, we're just so thankful. And of course, we just have one. Everybody's special, but we have that one that always stands out.
Which one stands out for you?
Jaleel Cameron. Oh my Lord.
He's going to be here?
At such a young age that he's actually taken upon himself to go to that great length to contribute.
$27,000.
It's incredible. I think that's should be a future fundraiser for the Health Authority in the making.
Or the junior president.
There you go. In the fact and the associations. I hate to start calling, and then to me, I think what really touched my heart is the family members that do it in the name of their loved ones. And I think that speaks to we're getting it right.
Yep.
But it comes back to us being consistent, and I think that's what we're working most towards, to convince the public that the people's is now the new people's, and give us the opportunity to be the provider for their health care and for that of their
The preferred provider.
Preferred
Provider. I want to thank you so much, Mrs. Baptiste, for taking time to sit and chat with me and chat with our audience and everyone looking at us on YouTube or on TV. We have been given the opportunity to see history in its making just in the opening of the new People's Hospital, and we were part of it.
And I don't want us ever, as a community, for us to take it for granted. That was a monumental undertaking. In most lifetimes, professional lifetimes, you don't see this opportunity, and the potential for this institution, it's endless. No matter where they come from, once they do the tour of the facility, everyone leaves with their jaws dropped. So if we could match that institution to the services, to the people, we're unstoppable.
Thank you.
Thank you so much.
We're going to take another quick break. When we return, we are going to meet with Dr. Vincent. He's from T.A.C, the Atlantic Clinic, and he's going to give us some information as to the new groundbreaking procedure that's going to be held right here at People's Hospital for the very first time. We'll be right back.
I'm a protector.
Soy enfermera at BBIHC.
I preserve life. I'm a surgeon at the BVI HSA.
So the Atlantic Clinic is a specialty network of surgeons, proceduralists, and medicine doctors that come from the United States, bringing U.S. patients down to the British Virgin Islands and People's Hospital in particular for treatment. But we also, in this process, will be helping out with the local care of BV Islanders and any other needs that the ministry and the hospital indeed need us to take care of.
Hi, I'm Michael, and this is Denise Hall, my wife of 30 years. We've come down here to have surgery because we were looking for a more relaxed atmosphere to where maybe I wouldn't try to do things around the house, and I would actually maybe concentrate more on getting well. One of the things I liked when I went into the hospital was everybody said their name. They were people. I wasn't a number. And I think that made me relax quite a bit. When they came in, they said, "Hi, how are you today?" And they even remember sometimes to say their name again, because with all the people you meet or anything and the nurse is changing, I felt like I was talking to a person instead of just a nurse or a doctor. I think that helped me a little bit. When they asked me if I need anything, the room itself had a nice view. It was relaxing. Anything that I had a question about, or just a kind word. How's your pillow? It wasn't just, again, I didn't feel like a number, I felt like a person. I think that helped me at the hospital. The island, without a doubt, instead of looking at walls and something you see every day, I'm looking at beautiful water, islands out there, sailboats going across. So it's always something to keep me occupied, because you're on medication, you're not feeling well, so it's, I think, it's easy to be distracted, and it's a fun distraction.
Quite honestly, if you're close to home and you have people visiting you every 2 minutes in a hospital, it's wonderful, and you appreciate your friends and your friendships, but sometimes it's about peace, quiet, relaxation, and healing. And I think it was easier actually being away from the distractions.
This was easier on me. I was very apprehensive before this started. I was concerned how I would react to all of it. This has made a lot of that anxiety go away. This has been about me instead of about, I guess, the surgery. I thought more about getting better than how bad I feel or if I don't feel well. I felt how good I feel or how I know the next step coming along the way again, because the doctors, the nurses, everybody's been able to tell me firsthand. So yes, I would recommend this to anybody.
Welcome back to Health Watch, and joining me is Dr. June Samuel, our Chief of Medical Staff and Medical Services here at the Authority. Welcome, Dr. Samuel.
Thank you, Franka.
It's a pleasure to have you here.
Thank you.
You are no stranger to Health Watch.
No, I'm not.
That's good. So much has been happening. We've been on the radio. We've been spreading the word of all the specialty services,
Yes.
right?
Yes.
Now we have viewers here on television as well as on our YouTube channel.
Okay.
Let's talk about the specialty medical services offered here at the Authority.
Okay, so my responsibility is to ensure that the medical services that we provide at the BVI Health Services Authority are in keeping with the needs of the community, as well as, supportive of whatever the board's direction is in terms of future development of services. At the moment, we provide the range of what I call basic medical specialty services. So that's things like internal medicine, which is adult specialty medicine, pediatrics, which is children, general surgery. So we have 2 general surgeons on staff, one of whom has a special interest in laparoscopic or minimally invasive surgery. So they do the full range of general surgery procedures. We also have anesthetists, and those are the physicians, who put patients to sleep. Basically, for the surgeons.
We have 4.
And we have essentially 4 individuals who can function within that role. And that the reason for that is because, well, that we have a 6-bedded ICU, and we're really making sure that we start to position ourselves in the surgical area to support some of the surgical specialties, subspecialties that we envision would be coming to the BVI. So, of course, having enough anesthetists around, we have 3 operating theaters. So if we wanted to run all 3 theaters at the same time, we have enough persons who can facilitate that. In addition, we have obstetricians and gynecologists. So we have 2 obstetricians and gynecologists on staff, and of course, that's pregnancy, childbirth, and women's services. All right. Our pediatricians also at the moment provide the services for neonatal intensive care. We have a neonatal intensive care unit, which is the unit that houses newborns that may be having any kind of difficulty at birth. And of course, the aim is that over time, we're hoping we can have a full-fledged neonatologist on staff, so that we can then be able to provide more services for the newborns and moms who may be having high-risk pregnancies. Right?
Actually, we have quite a bit of medical specialty services here. I think I'm seeing well over 10 and 15.
Yes.
But the Authority is actually adding more, or when I say adding, not permanently, but every now and again we are hearing that specialty physicians, teams of specialty doctors are coming in for specific reasons. Talk to us a little bit about that.
Right. So since we're the main comprehensive hospital facility on the island, one of the aims of the Ministry of Health certainly has been that the services that we should try to provide as many services as possible that the population has been needing to travel overseas for. So what we've been moving towards is bringing in specialty services, bringing those services to the people rather than having necessarily persons travel abroad. Having the new facility has been really helpful with that because it provides the infrastructure that specialists who are functioning at that level, at a tertiary level, would need. Because many of these physicians would be coming from places where the facilities are accredited and therefore would be function at a certain standard. And that is where we're aiming to get to.
Yes.
So in the past, we have brought in, for example, cardiothoracic surgeon who performed a procedure, what we call a thoracotomy. So we had a patient who had a particular issue with his lung that needed that particular type of specialty service. And we brought the person in from Jamaica and he performed the procedure for us. We've also brought in a gynecological oncologist surgeon who also provided services for 2 patients so far. Those, again, that particular type of surgery, patients would have had to travel overseas, and we were able to source the specialists and bring them here. They were happy to come. Bringing the specialists here not only benefits the patient, but it benefits the staff as well.
Of course.
Because, of course, over time, what we want to do is build up the capacity on the ground, build the skill level of the staff on the ground. So, the more that we can do that, we, in specific situations where we can provide the support, because of course, when you're doing certain types of procedures, you need the support.
Of course,
so if we can provide the support and can perform the procedure safely, we bring the specialists here. And then, of course, we would have been hearing about the Atlantic Clinic.
Yes.
And they're here this week.
Well, before we even touch on that, we had one a couple weeks ago with Dr. Patrick Roberts from Jamaica.
Right.
Let's touch about that.
Yes, so we brought in Dr. Roberts a few weeks ago, right? And Dr. Roberts is a specialist oncologist surgeon who worked with our general surgeons here on a patient who had colon cancer. And essentially they were doing a palliative procedure that would allow the patient extension of the patient's life. The patient had done radiotherapy, and therefore it was a follow-up procedure. And that went well. The staff here were quite appreciative. It was, as expected, a long surgery. And we're hoping that we can have him come back as we venture. We're starting to venture into the realm now of providing oncology services. So as we do that, there will be certain palliative procedures that can be done that are done in addition to or as a part of the treatment plan for certain types of cancer. That is actually a part of, is adjunct to their radiotherapy, chemotherapy, surgery is a part of what can be provided.
Wow. Do you see an increase in cancer patients here in the Virgin Islands? You don't have to go into specifics or statistics, but specifically, are you getting concerned that
we do have a particular concern about cancer in the BVI? Yes, it is currently the second cause of mortality in the BVI. In terms of persons who die from cancer or complications thereof. It's the second cause of death.
What's the first?
The first is cardiovascular. First and third are cardiovascular diseases, which is heart diseases, right? And what we also know is that many of these patients have been sourcing their service off island. Locally for some oncology services, there are some oncology services available locally, but the majority of the services needed by these patients have been sourced off island, and certainly for radiotherapy services. So
what we've been seeing more recently are patients who are now at end stages, okay, who are now needing like palliative care, hospice care. So based on the numbers that we've been seeing, we do know that yes, we have a significant issue with regards to cancer in the BVI. And you know, we've talked about it in the past about the need to have and develop oncology services within the limitations of what we can provide, because of course services for oncology can be vast and extremely expensive. So we're going to start with the chemotherapy services, and then we're going to build on that. There are some specific types of services we're going to be looking at in the near future, specifically as it relates to breast cancer, prostate cancer. We've recently embarked on an initiative to develop a clinic for patients who have prostate cancer, where they'll get a particular level of review done of their treatment plan. So I think we'll be talking about that in another program.
Not a stranger to Health Watch.
That is very new. We're working through it right now as we speak. So you know, we're gonna target the cancers that we know we have occurring with more frequency in the territory. So it's breast, prostate, colon cancer, and recently we've been seeing some endometrial cancers, and the gynecology surgeon who came, that you know, it was that particular type of case he was dealing with.
We are running out of time, but I definitely want you back on the program so we can speak more in depth about also what persons in the community can do, because one of the things we were starting to look at the authority was preventative, instead of waiting till we get to the end stage, or how can we build a healthier community? And we'll provide tips and things like that.
And that's covered under the primary care or primary care community medical services. And we're in the process now too of strengthening up that arm of the medical services, more primary care physicians, so that we can, you know, get persons along the path of prevention, regular checks, early detection, of course, so that you know, we have less of a need for the types of services that we provide in the hospital.
Of course.
It is expensive.
Of course.
You know, as much as possible worldwide, that's where the push is.
Briefly, let's get back to the Atlantic Clinic. They're on the ground this week. What does that mean exactly?
The Atlantic Clinic, you'd have heard the chairman of the board and the CEO talk about them. And this is a group of specialty physicians from the East Coast of the U.S. who have come together and are partnering with the BVI Health Services Authority. And essentially it's about, you know, them using our facilities to bring patients from the U.S., their patients that are interested in having their services and procedures done here in the BVI. And it really speaks to the level of facility that we have, that these physicians are board certified physicians, and they've been here, they've seen the facility, and they're comfortable about using the facility to provide services for their patients. And of course, one of the benefits that we will get out of that relationship is that you know, these physicians will be willing to provide those services to the local population as well, where there is need. So, you know, we're talking about neurosurgical procedures. There's some urology, orthopedics. But this is really at a high level. So once they're here, and we've, you know, this week we're running the first case, a test case, because of course you have to test all of your processes. It is not just about the processes in the hospital, but it's about all of the
the arms that go along,
that, yes, the patient will come into contact to.
Yeah.
As they come into the BVI, they're here for a few days. So we're testing that to see how that works and make sure that we have it, going well, so that the patient experience is a great experience.
Yeah, excellent.
Okay.
A lot is happening at the authority.
There is a lot going on. We are, the aim is to provide excellent service, and excellence is about growth. It's not a destination. It's a continuous journey of improvement, and we have a great group of medical staff who are really keen, they're interested, and they actively participate in everything that is going on. And we're at a good place, and we're moving to get to an even better place.
Of course. It's a pleasure. It's a pleasure having you, Dr. Samuel.
Thank you.
It's a pleasure. I'm always enlightened every time we sit together and chat.
Thank you.
Thank you.
It was good to be here, and I look forward to coming back.
Much more. Our Chief of Medical Staff, Dr. June Samuel. We'll be right back.
Good afternoon. My name is Andrew Monsanto. I am here at our new facilities at Peebles Hospital. It's one of the best and outstanding facility in the whole Caribbean. I will recommend it around the world. Anyway, I'm a man, and being a man, that means getting tested, and a sick man, that means you don't want to be tested. Have a good day, and try our service here in the British Virgin Islands. We are the best.
Welcome back to Health Watch. Again, I am your host, Franka Potter, and if you were with us for the last hour, you would have been getting information from the British Virgin Islands Health Services Authority. We had the opportunity to speak with our Chief Executive Officer, Mrs. Darlene Carty-Baptiste. We also spoke with some specialists that is currently doing a groundbreaking procedure here with us. And certainly, last but not least, we have the Chairman of the Board, Bishop John I. Klein, with us, and he's going to have a little chat with us as to informing us about the British Virgin Islands Health Services Authority. How are you, Mr. Klein?
It is well.
It is well with your soul?
With my soul and hopefully everything else.
With everything else.
Yes.
A lot has been happening in the authority. You've been here for, I think, 4 years? This is your second
Close
term?
To 4 years.
4 years? As the chairman. How do you find that role?
Interesting. It was a challenge when I took the post. I had a lot to learn, but I believe that I'm a fast learner, and I think that being in the role gave me an opportunity to, I believe, make a major contribution to my country. And I found it very, very fulfilling, actually. Sometimes frustrating, but very fulfilling overall.
We all know, it's no surprise to us employees here as well as the community at large. The authority has gone through a lot of challenges. What are some of the things that you think that the authority has had to deal with that would have been considered a challenge but have overcome it over these last couple of years?
I think the greatest challenge probably to an organization of this size would be a people challenge, both inside and out. From the public standpoint, dealing with the interaction of our staff with the public and the challenges that presents, and how we mitigate that and make it easy for those we serve to interact with our staff, especially when there's confusion over, services, what they should do, what ER is about, and so on. And then, of course, inside, when you're trying to build an organization and trying to raise the standard of care and deliver the best care possible, and coming from the old peoples to the new peoples, obviously we don't want to build a new hospital with old behaviors.
Of course.
So we had to train up our people, and making that transition in the mindset of the workers that this is a new day, and we're going to become the #1 caregiver of health in the region, but that's going to take
time,
them to be engaged, to buy into the vision. It's going to take time, but it's going to take commitment and consistency. So those are some of the challenges we've had, I would say, two of the major challenges. We won't even talk about the financial challenges.
Well, that's ongoing, but as I think Ms. Carty Baptiste said in her segment, the strategic plan, the growth pillar is really laying the foundation to start also seeing the organization as a self-sustaining one. So that is something that will hopefully curb some of the financial challenges. But we have had many achievements. Many that way outnumber the challenges that we faced. What are some of the achievements during your time as chairman of the board that you think were some of the milestones of growth and progress for the authority?
Well, I would say when we took over as this particular board, one of the major things that I wanted to accomplish was move our organization from a paper-based organization where you had most of the records being filed in a cabinet to electronic records. We've been able to accomplish that to a major degree with the installation of our information system, the health information system, and that has helped us to create what is one patient, one record.
Of course.
So no matter where you are in the BVI, whether you're in Virgin Gorda, Anegada, Jasmine Dyke, or Tortola, when you present to people's or in the community clinics, there's one patient, one record. And we could not have done that very effectively without an electronic system. And I think it's one of the major achievements that we've had in, it has helped us to also improve our billing, processes, our coding processes, the delivery of care, the continuity of care, whether it's from clinic to the hospital, what we call primary to secondary, or from physician to physician, that the physician in Anegada, after treating and logging it into the system, when you come into the system in Peebles, they have one record and they can see what that doctor's done. I think those are major achievements.
Those are major.
That sometimes, in the background people don't see.
Yeah.
But it's so important to delivering quality care to that patient.
And so we spoke of earlier in the program, confidentiality was one of the concerns that the board had as well as the community had in terms of where we go as an authority. The new Selma program allows for every person that logs into your record, it's noted. You're logging in with a password and things like that. Do you see a significant change in the level of confidentiality as relates to preserving and maintaining patient records and things like that? I know that from the clinical side, you're not, engaged and involved in it at that level. But from the board perspective, how do you feel that the new electronic program that you also helped to implement made a change in terms of how people see our records?
Yes. One of the things that people value and an organization as a healthcare system must value is trust. And your patients, your clients must be able to trust that when they present with whatever it is, that their information is secure. And the electronic system has allowed us to do that. Anybody can walk up to a filing cabinet and pull a paper. With the electronic system, you have to have passwords, you have securities, what a doctor can see, environmental worker can't see. Even what a doctor can see, some nurses can't see. So those things have been addressed, and we have worked hard to ensure patient confidentiality is a high priority on our list, that when you present, your information is safe, and just not anyone can access it. Because we hear that all the time.
Of course.
It's a small community. I want to go off island because I don't want nobody to know my business and so on and so forth. But I can assure the public that we've worked very hard in ensuring your information is secure, it's confidential, and we operate in a very professional environment.
And I'm glad that you said that because, and in cases, just again to just reiterate what Ms. Carty-Baptiste had said, in cases where there were identified and proven violations, those persons were terminated from the organization because there's a zero tolerance level.
Zero tolerance.
Yeah,
Yes.
yeah. Some testimonials. We have the pledge program. Persons have donated, and more we're getting positive testimonials. Persons that have visited, whether on vacation and had accidents, or our residents, that live here day in and day out. What do you think about the testimonials that are pouring into the authority? What does that mean to you?
Well, you see them more than I do, but I'm grateful for the updates, and when I see them, I'm like, how come the news doesn't report this?
It's good news.
Like the Vinos and the BVI News of the world, they want to call me for every little crap. Sorry for saying that. But the good news, they don't want to know about and they don't report. But we have had tremendous, just down to a couple of days ago, someone called me and say, we went to the private doctor, but our experience at Peebles far outweighed what we expected and what we got at the private doctor. So we had to, and still trying to overcome this perception that the level of care that we deliver is somehow substandard to anybody.
Yeah.
And I will challenge anybody, whether in the BVI or in the region, that we deliver good health care. And we understand that it takes time for people to build confidence in a system that they had lost confidence in. But we are working on it. The testimonials are there to prove the improvements we've made. And we're just excited about the future of this organization, like really excited about it.
One of the major activities that's been going on lately that is very board driven is the new strategic plan. You want to share a little bit about that?
I think if you want to go somewhere, you have to design that way. You won't just end up there. So the strategic plan really guides not just for today, but over the next 5 and maybe beyond years as to where the organization, where we want to take this organization, what kind of healthcare system are we building for the BVI. And that can't be for just the present board or the present persons. It must be a long-term plan that's developed over a 5-year period, that's achievable, that's sustainable, and all of those things. A part of those, one of the things that we are very focused on achieving is accreditation. And this is international accreditation. This is where our healthcare system is recognized the world over because it's judged by international standards. And we are fully committed to ensure that happens within the next 24 months. And all of that is a part of the plan of just building a system of excellence, of international quality, that people from near and far can access care and feel good about accessing care in our system.
One of the things also that we touched on in this program is the Atlantic Clinic that's visiting, doing some procedure here. In terms of long-term partnership with external medical facilities, how do you think that will help the people of the Virgin Islands?
In so many different ways. It helps to expand the variety, the not only the level of care, the quality of care, but the different services, the different specialties, that we can't hire every doctor for every specialty. But these doctors from the US or wherever we partner with, or Puerto Rico, have specialties that we don't have in-house, but we are working diligently to build the right partnerships, TAC being one of those, and the procedures and the patients that they're bringing. Medical tourism has been on our plate for about 3 years now. And again, it's one of the achievables that we hope to make a reality for the BVI, and especially in our system. The persons who visit our system, the infrastructure is here. They comment on the level of training that our staff has, and they believe that they can bring medical tourism that will help to upgrade provide a level of training for in-house staff, whether it be medical doctors or nurses or what have you, but also make it available to the general public, that you don't have to fly off to Puerto Rico or to USA, away from family, finances, building, hotel costs, but you can access that care right here in the BVI. And we see those type of partnerships like really being a great benefit to the public.
Of course, of course. Well, we are out of time.
But
Definitely, you have to come back on. We have so many other areas within the organization to discuss. How many members are on the board?
9.
9? So you have 8 other great leaders to sit
absolutely. They're really, really good people. They just push me. They fill in the blanks where I'm lacking. They're business-minded people. They're financial people. They're thinkers. And yeah, it's been a really good journey for us. And whenever we move off the scene, we would have hoped to have accomplished and leave the place, BVI HSA, in a better place that we found it.
Excellent. It's already a better place than when I came, and it's only 2 years, so much less in the 3 that you've been here. Yes. Thank you, Mr. Klein. Thank you. It was a pleasure having you. We will be right back. We thank you so much for joining us this far, and we ask you just to stay a little while longer. You'll be
Going down. The Facilities Management Unit would like to remind all visitors at People's Hospital to watch your steps when entering or exiting our elevators.
The British Virgin Islands Health Services Authority continue to make strides in making optimum health care available right here in the Virgin Islands to all the residents and visitors. Health Watch is a program brought to you by the British Virgin Islands Health Services Authority, where we'll provide you with information and update you on what is happening within the authority and the available services to you. As mentioned earlier, we will bring you we will address concerns that you may have. We want to thank you so much for taking the last hour of your day and life to sit and stay with us. We had with us Bishop Klein. He's the chairman of our board. We had Mrs. Darlene Carty-Baptiste. She's our chief executive officer. We had Dr. June Samuel, our chief of medical staff. And we also had a visiting physician, Dr. Vincent. We want to thank everyone so much for continuing to work hard, from our nurses to our doctors. And we want to encourage everyone that donations are still being accepted here at the authority. You can visit us on our webpage at www.bvihsa.vg, and you can also like us on Facebook, and you can tune into all of our programs and ads on our YouTube channel, BVI HSA. I am Franka Potter. It was my pleasure, and Health Watch is back, and we'll see you next time.